Hello, doctors. I am Dr. Donald Lozello of Championship Chiropractic in Las Vegas, Nevada. Shoulder abduction is one of the tests that is performed in Janda's movement pattern test. Shoulder abduction can be performed with the patient seated or standing. I'm going to demonstrate with the patient seated. We want the patient in good posture. We want to make sure that they perform the abduction motion of the shoulder unilaterally and then bilaterally. We want to look at how the spine moves to make sure that the spine stays straight. We want to look at how the shoulder moves. We want to look at how the scapula moves. So there's a lot included in this. You can do 3 repetitions minimal or increase that to as many as you need. Always have the patient move through a pain-free range of motion. We're going to start unilaterally and then we're going to do it bilaterally. Okay, go ahead. What I want you to do is you are seated in good posture with the palms facing forward. Go ahead and raise the left shoulder as high as you can. Excellent. Okay, go ahead and lower that down. Now, we're looking at a couple different things. We're making sure that the shoulder stays in the correct plane, and we're looking at the scapulothoracic joint, and we are also looking at the motion of the pec, because if the pec is tight, it pulls the shoulder forward, and then the shoulder is abducted, and the shoulder comes in front of the head. So that's why I was saying we want to look at the correct plane, and he did it correctly. Now I'm just demonstrating it passively, but actually these tests are all done actively. And if you could do it with the patient with no shirt on or with the tank top, then you could really visualize to see how these muscles are activated. And then we want to look at the scapulothoracic joint and see how that moves. Okay, now we're going to do it bilaterally. Go ahead and bring up both shoulders. Excellent. Okay, and go ahead and lower. So again, you saw that he performed it bilaterally very well. We want to make sure also that the patient does not slouch forward, that they do not flex their neck or protract their neck. We don't want to see any cheating. We're looking at the overall posture, the overall movement patterns, and the muscle activation. If the patient has an abnormal movement pattern, just as I described earlier, where when the abduction occurs, the hand is in front of the head, that can indicate there is a strength imbalance which is associated with upper cross syndrome.